Prepare, position, and oxygenate the patient with 100% oxygen. Select proper ET tube and style it if used. Have suction ready. Using the laryngoscope, visualize vocal cords. Use the Selig maneuver or burp to assist you. Limit each intubation attempt to 30 seconds with BVM between attempts. Visualize the tube passing through the vocal cords. Confirm and document tube placement using an end-tidal CO2 monitoring or esophageal bulb device. Inflate the cuff with 3 to 10 cc's of air. Secure the tube to the patient's face. Auscultate for bilaterally equal breath sounds and absence of sounds over the epigastrium. If you are unsure of placement, remove the tube and ventilate the patient with a bag valve mask. Consider using a blind insertion airway device if intubation efforts are unsuccessful. It is strongly recommended that the airway, if equipment is available, be monitored continuously through capnography and pulse oximetry. It is strongly recommended that an airway evaluation form be completed with all intubations.